I couldn't feel my knees. I couldn't feel my thighs. It was definitely not a good thing.
And he would just like suck his bottom lip in and bite down really hard.
You could walk into his bedroom and you could smell the blood.
You know, you hear tumor and you hear spinal cord. My first thought was, is she going to be paralyzed?
Next, two medical mysteries that defied the experts. When baby Tristan Derie starts compulsively biting his lips, his parents hope it's just a symptom of teething, but as the violent behavior intensifies, they soon realize that this bizarre and terrifying habit is just the beginning.
It's a really weird experience to watch your own child repeatedly hurt themselves, not being able to do anything about it.
Then, Janelle King is an active 26-year-old bucking for a big promotion. Little does she realize that a strange tingling in her toes is the first warning of a dangerous affliction that within weeks threatens to kill her.
It was kind of like getting hit by a bus. This can't be happening. Like, I don't have time to be sick like this.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In eastern Idaho, Sam Derie and Alicia Weymouth had been dating for 2 years, when in the fall of 2003, their relationship was jolted by some unexpected news.
I missed my period, and I was kind of a little worried.
She kind of informed me that she thought she might be pregnant.
And we went in, got tested, and they told me I was. So I was excited, and Sam wasn't very excited.
After I got over the initial shock, I think I went from being an adolescent to being an adult in a couple months.
His attitude was 100% changed. It was find a job, find an apartment, take care of the family.
Within the month, we got married. And Sam got his act together, he got a job, cut his hair. So it was like we had to grow up really fast.
On July 26, 2004, the couple welcomes their seemingly perfect baby, Tristan Samuel Derie, into the world.
He was 6 pounds, 6 ounces, and like 19 inches long.
I remember scanning his entire body and thinking, oh, thank the Lord, we have a perfect baby. We kept holding him and just realizing how much this little child is now depending on us.
Even though I was a first-time mother, yeah, I fell into the routine.
We didn't think it got any better. He did everything that we thought a normal baby would do.
But as the months go by, the Deries begin to suspect that something is not quite right with their son.
At the age of 7 months, I think Tristan was, he was still like having a 3-month-old baby.
He just still wasn't sitting up at all. He couldn't hold his head up. His head would just like flop over, and he was really stiff.
Frightened that Tristan may not be progressing normally, Alicia schedules an appointment with a new pediatrician.
He took his weight and did all like the normal pediatrician stuff. The doctor handed Tristan back to me and told me that he had hypertonia.
Hypertonia is a condition defined by an abnormal increase in muscle tension. This can reduce a patient's ability to stretch and move.
When he told me that, it made sense because he was really stiff.
The pediatrician told Alicia that as his muscles developed, he would develop and grow out of it. We probably wouldn't even be able to notice it by the time he went to kindergarten. We were happy with that diagnosis.
Per the doctor's instructions, the Deries begin taking Tristan to physical therapy 3 times a week. But over the next few months, he's barely managing to sit up on his own, and crawling seems out of the question.
I was in denial about the whole thing. I truly believed that by the time Tristan would have been a year old, he would have been right on track.
The young parents hold out hope that Tristan will begin to turn the corner soon. But at that same time, they receive some surprising news of another sort when Alicia discovers she's expecting once again.
I remember when she got pregnant, we were excited.
I thought that maybe having another baby, being around Tristan, I thought that it might be good therapy for him.
But on Tristan's first birthday, it becomes all too obvious that there's much more going on here than a new baby sister can fix.
My aunt planned a party for Tristan and her son, Ethan. They were the same age. We didn't like comparing Tristan to other kids. It was hard not to compare. Ethan was opening his presents, ripping the presents open, and Tristan couldn't open the present. I had to like rip it for him. Sam wasn't sitting with me. He was standing and watching, and I would glance up at him, and I could see that his eyes were really getting watery.
I remember that being an incredible moment. That was the moment for me that I really accepted the fact that Tristan was disabled or had a major problem. Something was wrong. I had to pick Tristan up and ended up taking him across the yard, and we kind of sat on a swing across the yard, and we just sat there and swung for a few minutes, and at that moment in time, I was falling apart. My heart was crushed.
The reality of the situation is painfully clear. Tristan isn't growing out of his hypertonia. But as the Derchies struggle to come to grips with their son's condition, they do take note of one encouraging development.
Tristan was 13 months old. He started getting his top teeth in, and we were excited. I thought that it was one of his first milestones, getting his teeth. You know, that he was going to be a little bit more like other kids.
But the victory is short-lived. A few nights later, Alicia notices something strange on her son's face.
When he woke up, he had a swollen top lip, like just a corner of it was swollen. I thought that he got bit by a spider. So I just kept an eye on it, and it went down like the next day, the swelling, so I didn't really think anything of it.
But Alicia soon recognizes that the injury to Tristan's lip is actually part of a disturbing pattern.
I realized that the swollen lip was from him biting himself. He did it mostly while he was sleeping.
I remember thinking that, well, maybe he just wants the teeth on his lip.
But the more the teeth come in, the worse the biting gets.
He started doing it during the day, and he would just like suck his bottom lip in and bite down really hard.
And his whole body would lock up, and he would just bite harder and harder. And by the time he kind of went through this little fit, he'd be bleeding. I
didn't know why he was biting himself. I had never heard of a child biting themselves before. So we decided to take him in to see a pediatric specialist.
The Derchies hope a physical medicine specialist will be able to shed some light on Tristan's developmental delays and his bizarre new behavior.
She basically just grabbed Tristan's legs and moved them up and down, moved his feet around, checked his arms.
But what the doctor says next sends the family reeling.
She referred to Tristan as having cerebral palsy, and Alicia and I kind of just glanced at each other.
I didn't really know much about it, but just the word doesn't sound good.
Cerebral palsy is an incurable neurological disorder caused by permanent brain damage that occurs during or shortly after childbirth. Though it originates in the brain, most of the symptoms involve severe problems with muscle coordination and body movement.
She said he developed the hypertonia because of the cerebral palsy.
It's a very vague diagnosis, and it didn't really mean too much, except for it was a name. It was something to call the problem.
The diagnosis comes as a major blow, but the young parents are determined to give their son the best life they can.
Personally, I had accepted it. I truly believed that the Lord had given me this child. We wanted to get him all the help we can get.
Still, they have one remaining question. Why is Tristan biting his lip?
She said she had never seen anything like it before. So she was kind of confused. She didn't know why he was biting himself.
Grateful to have at least part of the mystery solved, Sam and Alicia set about the difficult task of raising a child with cerebral palsy.
We finally had something to tell the physical therapist. They knew what to work with or how to try to work with him.
But as the weeks go by, the biting gets harder and harder to manage.
And it just continually got worse and worse and worse.
I tried putting a Band-Aid there so he would bite the Band-Aid instead of his face, but it didn't really work.
Nighttime seemed to be the worst. Tristan's crib would just be saturated in blood, his sheets and blanket.
I was having to change his sheets a lot more often. He was doing it more often during the day.
It's a really weird experience to watch your own child repeatedly hurt themselves, not being able to do anything about it.
In August 2005, a pediatric specialist tells Alicia and Sam Derie that their son Tristan has cerebral palsy. But she can't tell the young parents why Tristan has been compulsively biting his lip.
His sheets were covered in blood every night.
But the stress of Tristan's terrifying new habit isn't the only thing weighing on the young parents' minds. And in April of 2006, Alicia gives birth to their daughter, Grace.
Even though we were having all these problems with Tristan, I was excited to have her, come into our family.
But as Alicia settles into a routine with her newborn daughter, Tristan's biting takes a turn for the worse.
His lip was getting thinner and thinner, and it was a big, scabbed, opened wound.
And it was just one of those things that you just sit and you watch, and what can you do?
We just didn't have any answers. There weren't any doctors that lived near us that knew why he was doing it.
Desperate to stop the destructive biting once and for all, Alicia schedules an appointment with a local pediatric dentist.
The dentist worked on children with disabilities a lot, so I thought that maybe he would know why Tristan was biting himself. So we went to see him, and while we were there, he was completely shocked. He said he had never seen it before. He didn't know what to think.
Then, the dentist makes a shocking proposal.
The dentist said that the only thing he could think of would be to remove Tristan's top teeth.
The 4 top front teeth, because those were the teeth that Tristan was using to suck his lip inside his mouth and to bite down on it.
I didn't want to remove Tristan's teeth.
The mood we had when we went home was, well, we'll just keep doing what we're doing, and hopefully, when his teeth are all the way in, he'll stop.
But nothing could have prepared the Deries for what would happen just 4 nights later.
We heard a heart-wrenching scream.
I went and checked on him, and there was a lot of blood.
He had bitten that lip off, and I held him in my arms. And I remember looking at Lesch and said, well, he did it. He finally bit it off.
I was so scared. I was crying. I didn't know what to think.
That was pretty much the moment in my mind that kicked me into gear.
I decided that we had to remove Tristan's teeth.
First thing the next morning, the traumatized parents call the dentist and begin making arrangements to have his 4 front teeth removed.
And take him to these big doors, and then we handed him over to the nurse. It was really hard to accept the fact that he wasn't gonna have his top teeth.
The Deries wait anxiously while their son's teeth are extracted. 40 minutes later, the doctor pronounces the surgery a success and discharges Tristan that afternoon.
We took him home, and I felt like a bunch of weight off my shoulders, because I knew that he couldn't bite his lip anymore.
And in less than a week, Tristan's mouth finally seems to be healing.
It did close his mouth a lot from the scar tissue, so the opening of his mouth was small, but he seemed a lot happier. He was laughing a lot more and playing. I was so relieved that he couldn't hurt himself.
We were all encouraged that, yes, removing these 4 teeth we should have done it a long time ago.
But the optimism is short-lived. By December, Tristan has developed an alarming new habit.
His blanket started getting blood on him again. We realized that Tristan was biting again. We knew it was his tongue. When I would see him clamp down on his tongue, I would put a wash rag in there, and when I'd pull it out, there would be blood all over the wash rag.
We'd come in the morning, and you could walk into his bedroom and you could smell the blood.
And we were really afraid that he was gonna bite his tongue off. Or there's like a main vein in the bottom of your tongue. We thought he was gonna bite that off, like bleed to death in the middle of the night.
At their wits' end, the Derchies make the most difficult decision of their young lives.
We called the dentist that removed his top teeth. He was on Christmas break, so we had to look around for somebody because we didn't want to wait a day.
We have to get the teeth out, and we have to get them out as soon as possible.
I think I called 20 dentists, but they were all on vacation, and we just didn't slow down. We were gonna get those teeth out. And we finally found a dentist, and he got us in there, an emergency surgery.
So we went into the hospital. They were gonna remove all of his teeth, except for his 4 bottom molars. It was scary.
The next 2 hours are nothing short of excruciating. But when the surgeon declares the procedure a success, Alicia and Sam breathe an enormous sigh of relief.
Since Tristan didn't have any teeth, it was good because he wasn't biting himself. He couldn't show his tongue or his lip or anything.
He wasn't gonna bite. Even if he did, his tongue was gonna heal, and that tongue healed right up.
The exhausted parents finally begin to think that the worst is behind them. Until a week later, when a disturbing new behavior emerges.
He started banging his head on the floor or trying to hit his face on his high chair. Anything he could do.
When I realized that he was still trying to hurt himself, I didn't know what to think.
I've never seen anyone go to the point of totally mutilating themselves, hurting themselves, when obviously you could tell he did not want to be doing this.
Two-and-a-half-year-old Tristan Derie has been compulsively hurting himself for the past 16 months. Doctors believe he has cerebral palsy, but his parents are beginning to suspect that Tristan is suffering from something far more dangerous. At her wits' end, Alicia makes a frantic phone call to the family pediatrician, who immediately refers her to another doctor.
She said that she believed that we needed to go see a genetics specialist, and maybe she would give us some answers of why Tristan was doing this to himself.
The next day, Alicia makes an appointment for Tristan to see geneticist Dr. Susan Lewin.
When I first saw Tristan, it was obvious that what he had was a significant problem.
When we told her like what he was doing to himself, all the hurting and stuff, she said that usually people with cerebral palsy don't do that to themselves.
I think right away we knew that this was not straightforward cerebral palsy and something more serious was going on here.
Dr. Lewin takes samples of Tristan's blood and urine and sends them off to a lab for testing.
When we left Dr. Lewin's office, we knew that we were going to have to wait to find out for sure really what Tristan had, at least 2 weeks to a month.
The wait is almost intolerable. But 6 long weeks later, Dr. Lewin receives a phone call that will change the Derchies' lives forever.
I received a copy of the lab results and a phone call, and this confirmed the clinical concern that he was suffering from a condition called Lesch-Nyhan syndrome.
Lesch-Nyhan syndrome is an X-chromosome-linked hereditary condition that presents only in young boys. Patients with Lesch-Nyhan are missing an enzyme called HPRT, which helps to recycle various toxins in the blood. Without this enzyme, a dangerous waste product called uric acid builds up in the blood and kidneys, leading to severe muscular degeneration and bizarre behavioral symptoms.
Although we know the cause of Lesch-Nyhan syndrome, we have no clue yet what's actually going on in the brain and why self-mutilation happens, what the relationship is between the elevated uric acid and the brain function. Lesch-Nyhan disease is one of the most serious and most difficult conditions for families because it's chronic. There's no treatment at the end of it that offers a cure. So this is not an easy diagnosis to deliver to anybody.
It's a hard disorder to try to understand. At first, I was kind of in denial. I did not want to believe that that's what he had. but he fit it to a T.
Dr. Lewin explains that physical and mental delays like Tristan's are very common to Lesch-Nyhan, but no one can say precisely how the toxic uric acid levels trigger these symptoms. What they do know is that the condition can be life-threatening. In addition to the possibility of a fatal self-inflicted injury, the uric acid itself can be deadly.
The uric acid builds up, they get kidney stones and then kidney failure, and it's the kidney failure that has been the cause of death in the past.
Despite the grim diagnosis, the Derchies are more determined than ever to help their only son.
I'd made the decision in my mind that it didn't matter. I would do whatever it takes.
And the couple is encouraged to learn that there is hope for Tristan.
Even though there's no cure for Lesch-Nyhan syndrome, we can treat the symptoms.
Dr. Lewin immediately puts Tristan on a medication to help lower the high uric acid levels in his blood and kidneys. And within just 2 weeks, there's a dramatic improvement.
Tristan responded really well with the medicine.
It was amazing how instantly he started just acting better. He was happier. Within a few months, he's taking on quite a growing spurt.
The Derchies are relieved to finally have an answer, but they can't help but wonder why the truth eluded doctors for so long.
Lesch-Nyhan syndrome is a relatively new clinical diagnosis, and when it starts out, it looks typically like cerebral palsy. Not all the findings are present. It's a very rare disorder, and so unless you are suspicious, it's not going to cross one's threshold until the children are a year old or older.
Today, Tristan is 4 years old, and he's making enormous strides.
Tristan's health has been wonderful today.
His uric acid level is down to normal.
One of the most interesting and exciting things for Tristan was the use of horse therapy or hippotherapy.
And it can help children learn how to walk and balance themselves better. He really likes it.
But while the medication and hippotherapy are helping Tristan make important developmental gains, he continues to try to hurt himself. So, like many parents of Lesch-Nyhan sufferers, Sam and Alicia have improvised ways to protect him.
I've taken pipe insulation and wrapped his entire crib with it. We just strive every day to control everything around him so that he's protected.
And while they recognize that Tristan will always face serious challenges, they make a point to celebrate each step their little boy takes.
Tristan's starting to talk more now. He's starting to say mom and dad.
And I know Tristan loves me because he lets me know. You know, he tries to give kisses and he tries to do what a normal child would do, but he has that look in his eye of that he looks up to me. I just can see it.
This experience, I think, has helped me grow up a little bit. It just helps me appreciate life better.
While it was clear the day Tristan Derchie's first symptoms set in that something was very wrong, Janelle King had no idea that a potentially life-threatening disease was slowly ravaging her body. In the summer of 2005, 26-year-old Janelle King was having the time of her life, traveling the country and entertaining young kids.
In 2005, I was starting my second season on tour with Sesame Street Live, the live theater version of the television show where we have live dancers and performers. My technical title was assistant company manager, although I was about to be promoted.
She loves people, and she certainly loves children, and the fact that her job entertains children meant a lot to her.
We worked a lot of hours. I easily could work a 60-hour week without blinking an eye, so it was a lot of work, but it was a lot of fun.
But 3 weeks into the tour, Janelle's hectic schedule seems to be catching up with her.
We were in Minneapolis in rehearsals before we opened the show, and I was just excessively tired and just not feeling totally myself. I thought maybe I was just taking on too much too quickly.
Firm in her belief that the show must go on, Janelle pushes through the incessant fatigue. But a week later, at a performance in Colorado, a strange new symptom suddenly emerges.
My toes were tingling. It was like when your foot falls asleep and you have pins and needles in your foot, and I couldn't get it to wake back up. I didn't really know what to think.
Within a few days, the bizarre tingling begins to spread from her toes up into her calf.
I was walking across the parking lot from the hotel front desk to my room and couldn't keep my flip-flop on my foot, which I know sounds ridiculous, but like, I couldn't keep a flip-flop on, and I was like, this is just wrong.
Alarmed by the peculiar symptom, Janelle tracks down a local neurologist and sets up an appointment for that day.
He did a physical exam where he tested my sensory perception and my strength, and came to find out that I had some numbness all the way up to like my shoulder blade that I didn't realize was there. And at that point I realized maybe I wasn't totally fine. So he set up an MRI for me. They threw me in the tunnel and scanned me out, and then I went back to work.
At the end of the day, Janelle returns to the neurologist's office for the MRI results, and they're not at all what she was expecting.
He brought up the picture of my MRI scan and showed me my spine. He said, there's this spot right here that's kind of cloudy, and I guess we're gonna call that a lesion in your spine.
Lesion is a general term used to describe an unidentified cloudy mass on a body scan. Lesions are often benign, but can still pose a danger to the affected area. The doctor tells Janelle that he wants to send her scan to a Maryland neurologist who specializes in spinal lesions for a second opinion.
And at that point, I said, should I be worried? And he said, well, I don't want you to worry just yet. I want some more information. So I didn't worry. I was expecting to hear back from the doctor in Maryland in 3 to 4 weeks. I thought, okay, I'll just wait and see what happens.
But later that very same week, Janelle receives a call from the doctor that will change her life forever.
And my phone rang, and it was the nurse, the receptionist for the doctor in Maryland saying, hi, I have the doctor on the phone. He'd like to talk to you. And then I thought, it's only been 4 days. Why are you calling me? Like, you're not supposed to be calling me this soon. And then the doctor was on the phone. He was all, you have what could be a tumor on your spine. I feel like we might have to do surgery. It was kind of like getting hit by a bus. This can't be happening. Like, I don't have time to be sick like this.
For more than a week, Janelle King has been experiencing a strange tingling in her toes that has spread up her leg. Now, a specialist in Maryland suspects that a tumor on her spine is causing the bizarre sensation.
You hear tumor and you hear spinal cord, my first thought was, is she going to be paralyzed?
The doctors are convinced that Janelle has no time to waste. She needs to get to Maryland right away for a full workup. It's one of the most difficult days of her life.
I realized, I had to leave work. There was no way I could stay. I told my boss first everything that was happening, and of course cried again.
She had to make that decision to stop working. It was hard. She was giving up her dream, certainly.
Janelle moves all of her belongings back into her parents' house in Connecticut. And 3 days later, she and her mother arrive at the hospital in Maryland.
The hospital was huge. There were people everywhere. So many people, question after question, test after test, scan after scan.
They were going to spend the second day collecting medical data, and then the third day, they were going to do surgery on her spine.
By the end of the second day, the doctors believe they have enough evidence to move forward with the surgery.
He said when I woke up from the surgery, I might not be able to feel my legs. I might not get off the table.
They mentioned her not making it through the surgery. It was a very terrifying, absolutely terrifying moment. It's the moment that I don't think I'd want to have to relive, frankly.
But a few hours before the surgery is scheduled to begin, Janelle's doctor makes a radical change in plan.
Tuesday night, it was pretty late, and they came in and said, okay, so we're canceling your surgery. The benefits of doing surgery just didn't outweigh the risks. It was too risky to take a chance when they couldn't say for certain, yes, this is 100% sure a tumor.
It was, oh, what a relief. Thank God. It's not gonna happen.
It was kind of like, hallelujah, no surgery. And the next second, it was kind of like, but wait, we still got more.
In the absence of a tumor, the medical team speculates that Janelle may be suffering from a mild form of multiple sclerosis. Multiple sclerosis is an autoimmune condition where the immune system attacks the central nervous system. Patients with MS often have difficulty with muscle control, strength, and balance.
Because of various pieces of my blood work and the lesion on my spinal cord and the tingling in my feet, there were too many similarities not to consider it.
I knew that it was a disease that you can live with, so it was really a relief. Finally, there was a name for this problem that she's having.
But tests on Janelle's spinal fluid come back inconclusive for MS. Despite the uncertain results, the doctors decide to treat her with IV steroids in an effort to reduce the inflammation in her spinal cord. And within a few hours, Janelle feels a distinct change.
The tingling started to recede, and I started to get the feeling back properly in my feet.
We were actually at the hospital for maybe 3 more days. And after the 3 days, they gave her a clean bill of health.
I was ready to go home, and I had the majority of the feeling back to normal in my calves and my feet.
While there is no cure for MS, the medical team assures her that with proper treatment and extensive physical therapy, she'll be able to manage the disease.
I got back home, and it was almost entirely back to life as normal. I was walking again without stumbling. I was driving again. Things were really regular.
I was just so happy for her, and I can tell you that I was relieved.
The rest of the family thought that she was on the way to recovery and this would be all over. We could get along with our lives again.
In fact, almost a month after returning home, Janelle begins to consider going back to work.
I got in touch with the home office and talked to them about what was happening, and everybody breathed a huge sigh of relief. And the operations manager said, we were ready to promote you anyway, so we want you to fly out to California and continue from there. That was great for me. Like, that literally was everything I'd been working towards.
Well, because Janelle was feeling so well, my husband and I decided to take our annual vacation to Jamaica.
I dropped them off at the airport, had the house to myself for a few days. I was ready to go. Like, a little over a week before I was supposed to be at the airport to fly back out, I started to have some back pain. I thought, great, okay, I did too much hauling my bags around and tossing stuff everywhere, and I just did too much lifting.
But over the next 48 hours, the seemingly ordinary pain begins to intensify. And by Thursday evening, she can no longer pretend it's just a muscle strain. At 8 p.m., Janelle makes an anxious call to her aunt and asks for a ride to the hospital.
And it wasn't until my aunt was trying to help me out of bed to go to the hospital that I realized, like, how weak I was. My back pain had started to kind of creep up my neck, and my neck was kind of stiff. I had this overwhelming sense of something's definitely wrong.
When she arrives at the hospital, the emergency room staff rushes Janelle through triage, and an ER doctor immediately begins a thorough exam.
It was probably within the hour. They poked my foot, and I couldn't feel it. And that was the first time I realized I couldn't feel my foot. And as they were poking me higher and higher, I realized I also couldn't feel my calves. We were thinking, like, what's coming next? I just knew that it was definitely not a good thing.
What seemed like a slight tingling in Janelle King's toes just a week earlier has turned into a terrifying paralysis that has engulfed her body from the waist down. And it's rapidly becoming clear to her that the medical team has no idea what's causing it.
You could feel the worry in the room. It was tangible, it was heavy. Everybody was really, really concerned.
Overwhelmed, Janelle reluctantly asks her aunt to alert her parents, who are still on vacation in Jamaica.
I got a phone call from my sister Derie to tell me that Janelle was in the hospital. I said, what did you say?
And she was just blown away. She could not believe it at all. She left Janelle 2 days ago in perfect health.
My first thought was, I have to find a way to get back to her as soon as possible.
While her mother frantically makes travel arrangements, the paralysis continues to spread to new areas of Janelle's body.
By early the next morning, I couldn't feel my lower belly. I couldn't feel the first 3 fingers in my right hand. It was kind of just like every hour that went by, the paralysis crept higher and got worse.
Desperate to find out what's triggered the paralysis, doctors perform another MRI. The second scan reveals that the lesion doctors found on Janelle's spine a month earlier has nearly doubled in size. This is a clear indicator that she doesn't have multiple sclerosis after all. Unfortunately, it's a clue that leaves them with more questions than answers.
It was really upsetting to realize that, you know, I thought, okay, I got through it. And now all of a sudden, I was not only not fine, I was 8 times worse than where I'd started.
With no time left to waste, the medical team calls in neuro-ophthalmologist Dr. David Weitzman to take over her case.
When I first looked at her MRI, it was rather dramatic. It was probably one of the most dramatic MRIs I've ever seen. The first time I met Janelle, there was evidence of weakness in her right arm. And that was concerning because she hadn't had that at her previous presentation. I was concerned that it might actually extend to involve not only her left arm, but also her ability to breathe.
The next concern was, what happens if her respiratory system shuts down? Because once you stop breathing, you're in a world of hurt.
Based on Janelle's symptoms and the large mass on her MRI, Dr. Weitzman suspects that she is suffering from some form of an inflammatory condition. To verify his suspicion, he performs another spinal tap and rushes her fluid to the lab.
The spinal fluid reflects almost directly what's happening in the central nervous system. Janelle's spinal fluid showed over 300 white cells in each cubic millimeter of spinal fluid, and normal is considered 5 white cells or below. Now that we understood that there was an inflammatory process occurring, the fluid was sent for a variety of different studies, which would take a couple of days to come back.
But Dr. Weitzman can't wait for the test results. His first priority is to stop the paralysis from spreading.
We had to make some decisions about how to treat Janelle in the meantime so as to prevent any additional loss of neurological functions. So one of the first lines of treatment in a patient who has this degree of inflammation is intravenous steroids. The steroids reduce the inflammation in the spinal cord regardless of its source.
Dr. Weitzman immediately puts Janelle on a high dose of IV steroids. But he's worried that the treatment might already be too late.
Because of our concern that Janelle's condition would worsen overnight, she was placed under a high degree of observation in the intensive care unit. We hoped that by early morning, she would have some improvement. When we went to see her the next morning, unfortunately, their hopes were dashed.
I didn't feel anything differently. It was kind of disconcerting because it seemed like that was the thing that everybody thought was going to make a difference. It was really alarming. It was kind of like somebody wrapped an ace bandage around my lungs and just kind of kept pulling it tighter and tighter until it was just like a constant pressure.
I was concerned that she might stop breathing and could expire as a result of the progression of her illness.
Over the past 2 days, a bizarre and potentially deadly paralysis has seized control of Janelle King's body. And now, it's beginning to restrict her lungs, leaving her struggling to breathe.
It was just so surreal. Like, I literally was kind of like, this is crazy. Like, how could this be happening? It just didn't make any sense.
In a race to save Janelle's life, Dr. Weitzman decides to treat her with a procedure known as plasmapheresis.
Plasmapheresis, to put it in a nutshell, is a filtering process where we actually filter the blood.
Over the course of the next 4 hours, Janelle's blood is removed from her body through IV tubes. It then travels through a series of specialized filters before being pumped back into her body.
It was going to cleanse her of what we felt was an antibody or an inflammatory protein that was causing a direct attack on the spinal cord.
Later that night, Her mother's flight finally lands in Connecticut, and she races to the hospital.
I walked right into the room to see her, and there she was. I'm looking at my child and I'm thinking, what's gonna happen to her? I sat at the foot of her bed all night. I couldn't sleep, I couldn't think. I just sat there and watched her because I didn't know what else to do.
For the next 24 hours, the entire medical team is on high alert, looking for any sign of improvement.
We walked in to see her on, I believe it was the 4th or 5th day in the hospital.
And somebody made an exclamation like, "Oh my God, her cell moved."
And I was so happy, and I felt that when she started feeling in her toes, then yes, she was on the road to recovery.
And I was encouraged that we might be able to win against this inflammation.
Everyone is elated by Janelle's rapid progress. And by the end of the week, Dr. Weitzman finally receives Janelle's results from the lab.
They told me that this was indicative of an illness known as Devick's disease.
Devick's disease, or Neuromyelitis optica, is a rare inflammatory condition in which the body's immune system inexplicably attacks the coating surrounding the nerves in the spinal cord and eyes. This attack causes severe swelling, which can lead to symptoms such as blindness, weakness, and paralysis. No one knows what triggers the inflammation, but if it's not treated, Devick's disease can be deadly.
We don't have a cure for Devick's disease, but we can keep the disease under control. After we got the results of the antibody test, this suggested that we were on the right track in terms of treating the autoimmune process.
They weren't necessarily certain at that time that I would get enough sensation back or enough strength back to be able to walk. You know, I was kind of like, dude, I'm getting back on my feet. What are you talking about? Like, if I can feel them, I'm going to use them.
She's a fighter, and she was determined that she was going to walk again.
And with assistance was able to walk almost 20 or 30 feet. I think that was rather dramatic.
After 3 grueling weeks of rehab, Janelle is finally cleared to return home. But while the family is grateful for her recovery, they can't help but wonder why it took so long to get a solid diagnosis.
Devick's disease is a very rare condition. We see it probably in 1 in 20 or 30,000 patients. I think that if we did not make the diagnosis, she would have had a serious progression of paralysis and possibly even loss of respiration and death.
Today, Janelle continues to go to physical therapy and is close to walking on her own again.
Janelle has really taught our whole family a lesson in perseverance, not giving up.
Janelle is determined to beat the disease for good, and Dr. Weitzman has assured her that she can keep it in check by taking immunosuppressants for the rest of her life.
Over the last 2 years, Janelle has been on a slow taper of the steroid medication, and Janelle's most recent MRI looks absolutely normal. And I think that Janelle's prognosis is excellent.
She is on her way to being her old self again, and I can't wait.
I'm not one to do the 5-year plan anymore. I think you take life as it comes and do the best you can with it, and that's enough.